My name is Dr. Kailash Mantri. I am a life coach and a mental health consultant. Today we'll be talking on arthritis. Arthritis is basically a lifestyle disease. It is one of the biggest diseases in India. More than 20 crore people are affected due to this disease, and every year 15 lakhs people are added. It is a lifelong disease. That means so far there is no cure for arthritis. Once you get arthritis, till death, you have to experience pain and the suffering. World over also, more than 5% people suffer from arthritis. We have developed a very unique treatment for arthritis because we have undergone as to what is the root cause of arthritis. The root cause of arthritis, 80% is psychological and emotional, and 20% is physical. Now it is observed that people who have arthritis are usually into tobacco chewing, smoking, alcohol or excessive tea. We have observed more than 100 patients, and we have found out that the major psychological reasons are excessive fear, anxiety, stress, tension, suppressed emotions, sadness, inferiority complex, and many such things. The physical reasons are acidity and gas, and it is mainly due to sedentary lifestyle. The person doesn't move much. Sometimes he is overweight, he doesn't do regular exercise, the lifestyles are bad, eating habits are bad. But it is a myth that it is genetic, that it is biological, that it is hereditary. It's a lifestyle disease. We have got a 1-month treatment package for arthritis, wherein we give 10 to 25% of the progress within a month. And every person has got a different story of suffering. Recently we came across a lady who is 45 years of age and is suffering from arthritis for the last 10 years. And her story was that she was misguided, that sex is bad. She enjoyed controlling it because she was getting appreciation from some social organization. And for 10 years, even after married also, she used to pretend that she is not interested, and she had all the disease in her body, including arthritis. Now what is arthritis? It is basically a joint pain. And in our body, there are many joints of bones. But the major joint is the knee joint and the hip joint. Depending on seasons also, in cold seasons, people have more stiffness, more swelling, more pain in their body. Usually it is found after sleeping for 8 to 9 hours. When the person gets up, early morning pains are very bad, and slowly as they move their body, the pain reduces. Now what is the present treatment right now? The present treatment is only giving them painkillers, making them do some physical exercises, and at last stage surgery is also an option. Now what food to take and what food to avoid? Normally person who has got arthritis is basically not aligned with nature. All the habits are against the nature. He will wake up late, sleep late, take excessive tea, have empty stomach, and tobacco, alcohol, tea, smoking are all against the nature. And he does minimum exercise, or I would say no exercises. So food to intake is all natural foods, vegetables, fruits, coconut water, light food. As far as possible, he should avoid oil and fatty foods, bakery products like biscuit, bread, pastries, dairy products like milk, tea, curd, ghee, etc. Now basically what happens in arthritis is the juices of the body get reduced, either due to acidity or due to intake of tobacco or medicines. And because there is a reduction in juices, there are noises also which are created at the joints. So far the treatment is taking painkillers, getting oil massage, doing physical exercises. The best exercise for arthritis patients are swinging legs, swimming, cycling. Wherever the pressure on leg is less, that is the best exercise for arthritic patient. Our treatment is very holistic. For 10 to 12 hours, we treat the patients, out of which 60% treatment is for physical body and 50% treatment is for mind detox. We also have a weight loss package, people who are overweight, and we treat all the lifestyle diseases. And arthritis is the biggest disease and the most painful of all the diseases. So far it has been believed that once you have arthritis, till death you have to experience pain and the suffering is lifelong, which is no more. Our research says that in 1 month also 10 to 20% improvement is possible, but since the disease is almost 8 to 10 years, it takes long time to get rid of it, maybe 2 to 3 years, and the person has to change his lifestyle, change his attitude. It's also found that people who suffer from arthritis are people who are very serious in nature. They hardly laugh, they hardly enjoy, they are more workaholic and all the time on toes. They need to relax, they need to feel connected with people, they deserve happiness, they need to start smiling, and they need to start enjoying life. We are the pioneer in the treatment of arthritis, and within 1 month patients will find some recovery. We have developed a very transparent test. We have named it as mind mapping. There are more than 500 questions on it, and within 15 minutes the patient can give this test and can find out for himself what are the root causes of arthritis. Also, we need to listen to their life story, which is definitely not good. They have suffered a lot, they have gone through a lot of hardships, and that's why juices in the body has reduced. Their oxygen intake is also very bad, their breathing is also very shallow, and there has to be a 360-degree change in their lifestyle, which is possible within a 1 month period. They have some philosophy of life which are against nature and which needs to be corrected. It is estimated that 35 to 40 crore people all over the world suffer from arthritis. Now there are two types of arthritis. We are not going into details of it. Basically, arthritis is a joint pain. There are nearly 100 types of arthritis. At the end, I would like to conclude that arthritis is a lifestyle disease. It is also a psychosomatic disease, and one need not conclude that it is non-curable. Within a month, the progress can be seen, but the person has to change his lifestyle, has to change his attitude, and can reduce his pain, his suffering from arthritis. If the person age is less than 45, he can be optimistic that up to 75% recovery is possible. And as the age progresses, the recovery percentage is less. Above 65, not more than 15-20% recovery is possible. He has to increase his oxygen intake. He has to regularly do exercises. Yes, yoga and pranayams are also advisable. Not much of benefit, but advisable. One should do it. And I would say, if the person spends 4 hours on his health, he can live for long life with less pain. I am Dr. Kailash Mantri, life coach and a mental health consultant from Mumbai, India.